Presentation of that model graphically that is in part the model itself as released by the Ohio Department of Health, and is a part, in other parts, is the tailoring of that model to our particular circumstances here in Portage County. Over the last couple of months, a number of us, including Jeff Neistat, Chip Porter, and Karen Town, and Heather Baird, and myself, and Josh, and others have gotten together and tried to figure out how are we going to make this process work. So what you're looking at is the CHIC model as it is released by the Ohio Department of Health, amended a little bit to tailor to our particular circumstances. And I'd like to kind of walk you through that very briefly so we all kind of understand that big picture. I'm going to invite Karen to at any point jump in if I start fouling this up, because Karen has used this very model in going through the maternal and child health assessment process that had taken place over the last, year or two, culmination last summer if I'm not mistaken, and other progress since then. The first thing I'm going to point out to you is that one is in that center circle and it's called self-assessment. In the big picture, over the last few years, through these efforts that we're talking about, steps 1 through 5, we believe, have either been done or very close to done. And I want to explain to you at least some of the pieces as to why we believe that's the case. Each of the health departments in the state of Ohio conducts a self-assessment on a regular basis. Those self-assessments have been conducted by the Portage County Health Department, the Ravenna Health Department, and the Kent Health Department. We have the results of those health assessments and they are available. I don't know, you probably have one due coming up soon as well. Is that right, Chip? Another round of that?
Soon.
Yeah. Well, the one we've got in our files, I think, is dated 2011, if I'm not mistaken, and we have them for different departments in the county. So that process has demonstrably been done. There is also the interest in an external assessment. And often public health systems go through a process that's called a Public Health Performance System Review. And that process was conducted here in Portage County in December of 2012. I was involved at that point in the process and was there, as were, I think, a number of people in this room. And that process culminated in a report that is available to anybody in this room who wants to see it, that talks about the strengths and the weaknesses of the public health system in Portage County as perceived by those stakeholders who participated in that one-day event in December of 2012. Building partnerships. That was really, I think, arguably a key part of the purpose of the Task Force for Improving Public Health that Ralph Kletzian and Bob Howard provided leadership for over a period of several years. I think arguably it occurred through the work group process that was done pursuant to the Robert Wood Johnson Foundation grant as well. And out of those processes came a series of plans, and in fact we're here because of one of those plans. There is also, as a part of the Robert Wood Johnson Foundation grant process, an action plan that we've got to complete over the next several months that will in fact, build on and move beyond the planning that has taken place already. In addition, there's been a significant effort to collect data on public health needs in Portage County, as well as on the capacities that exist in Portage County in the health arena. I'm going to point out, I've been throwing around the number for, I guess, I don't know, Josh, how long have we been counting these things? Probably 6, 8, 10 months. We've tried to get our arms around everybody who's looked at the public health system in Portage County, and we can find about 6 or 8 documents that are reasonably intensive over the last 3 to 4 years that have tried to look at public health needs and or performance in Portage County. 3 of those documents, and this is a number that Heather has just been pinning us down on over the last couple, 3 weeks, really focuses in on health needs. There was a needs assessment that we did with county level data from the county level health rankings that are issued on a regular basis by the University of Wisconsin Population Center with funding from the Robert Wood Johnson Foundation. That document came out in January of 2014 in its final form. There was the health assessment process for maternal and child health that both Karen and Dr. Baird were intimately involved with that was completed last summer. That is, if you have not had an opportunity to look at that document, I would encourage you to do so. There was tremendous work, tremendous effort that went into that. And unlike the overviewish document that was produced in January of this year that was county-wide and very broad in its scope, this document zeroes in on far more specific information on geographic variations within the county, on indicators for which those data were available. So that is a second needs assessment that is available here and is quite current. A third set of needs assessments was done and just came out a little while ago. Josh, when did the hospital needs assessments come out, you remember?
6 months ago?
6 months ago or so.
End of summer.
Yeah. What, I'm sorry?
End of summer.
End of summer. The hospitals in this region, many of them in Summit County, I think Suma did one, and Akron General did one, and there was one other, Children's was the third. And they teamed up on a set of needs assessments covering their service area, of which Portage County was one, and one of those health assessments actually carved out and had specific data and reporting on Portage County. So we have 3 significant efforts that have all come out in the last year that deal with health needs in Portage County. When we talked to Commissioner Porter, Commissioner Neistat, and others, I think there was a judgment made. We're doing all these needs assessments. Let's stop and look at what has been done and decide where we are. I will comment, this is an area where Dr. Baird is far more expert than I am. But we can certainly find strengths and weaknesses in all of these needs assessments. The data we've got is not perfect, but it is a body of data and it is a place to begin. And so the assumption underlying this effort has been that we would use those needs assessments, look at them, and try to construct something that has strong expert input that is based on the work that has already been done. With the concept that if we find there's information we'd like to know more about over time, that information can be collected over time as this process unfolds in coming months and years. All of that, by way of saying, is that we believe right now we're roughly at stage 5 in this model, is what that long-winded explanation was trying to point out, if you will, while adding a little extra bells and whistles. Now, if you go to the upper right-hand corner of that model, there's something called previously identified health needs and partnerships identified health needs. And then it has arrows going down to criteria for evaluation and substantiated needs. That piece right there is what we are conceiving this group will do. Look at the health needs and the health capacities that come out of these multiple assessments that have been done over time. And I look first at the needs that have been identified through those processes, have a parallel process where you all, as experts and informed members of this community and county, can feed in information on needs that is an independent flow of information separate from those analytical exercises. Bring them together, establish some criteria for determining what is a substantiated need. What's a need we believe versus one that somebody may just assert. And then have this report reflect the collective judgment of this group about what are the substantiated health needs in Portage County. Now you'll notice we still haven't gotten to step 6. Step 6 is the priority setting process. And in the process of a community health assessment, community health improvement process, the priority setting mechanism, at least as described by the Public Health Accreditation Board, targets the priority setting around those needs to occur through something that's called a community health improvement plan. And it is my understanding that the health departments plan to pursue a community health improvement planning process based on the substantiated needs that come out of this group's work over the next several months. So this group would be looking at what are the needs that we're aware of, how do we determine whether we believe them or not, and some of that's going to be based on data, and quite frankly, there's some of these needs that there is no data for. So we're going to have to put our heads together as a group and determine how can your expert views be combined in a way that substantiates needs where you perceive them. And if there's needs over time to build a stronger data set underlying it, that can take place over time. I think the plan at the moment is that this group's work would try to culminate in the August, September, October timeframe. And about that time frame, a group would be established to guide the community health improvement planning process, whereby the needs are looked at with the capabilities in mind, and strategies are developed collaboratively to address the needs that are identified. And to do so in a way that is systematic and shared to the extent possible. That's right. I'm going to stop for a moment. Kelly, you want to say hello and let people know who you are?
And apologize for being late. I'm sorry. My name's Kelly Englehart, for those of you who don't know me. I'm currently the service director for the City of Ravenna, but I also serve as the interim health commissioner for the City of Ravenna Health Department that is now merging with the county health department. So my previous experience as a public health nurse, and I was the director of nursing for a lot of years at the county health department. So, and I apologize, I got hung up with a irate resident about stormwater drainage.
I can't imagine why today.
The other thing I will point out, and Chip referred to this in his comments a few moments ago, there's a couple of words called community engagement that are linking stages 6 to 7. And these words were put in at the request of the health commissioners when we met last. They envision taking these substantiated needs that come out of this group and going out to a public, yet to be defined, to get their feedback in a priority setting process associated with those. The point I would like to make, however, is that even those assessments are going to feed into a community health improvement process through which judgments will be made about where should this community put its time and energy in moving forward in improving public health in the county. And that's going to require a group to come together, much like you are now in the fall. It may have significant overlap with this group. I don't know that the thinking has been done as yet on how to bring that group together. Indeed, I think it's a fair statement to say that one of the things we hope to get from you is guidance and input on how that might be constructed. That group would meet over the course of the coming months, and I think the target is to have a community health improvement plan completed next summer, toward the end of the summer, that would then essentially set quantitative targets, priorities, and I would envision potential data collection agendas to refine this process over time. The intent here is to create a shared set of understood needs within the county that can be dynamic over the long term and enable collaborative efforts in healthcare, mental health, the whole full range of public health concern. Presumably, after that community health improvement plan is completed in stages 6 and 7, there will be an implementation effort. And that implementation effort, I'm hearing very clearly, will take place within the health departments, but I think the hope is that the stakeholders around this room can participate in this process with sufficient engagement to make that a part of their individual organizational plans, so that at the end of the day, we got multiple stakeholders with multiple services that know what each other are doing, can make the kinds of referrals that you all are talking about, and we can maximize the effectiveness of the overall system toward a defined set of goals that are measurable over time, that can, in the end, give more focus to the public health improvement effort here in the county. That is the concept behind this model. I'm going to stop. I'm looking at Karen. Did I get it right?
Yeah, I think you've done a great job.
Nothing to supplement it?
But the only thing I might say is just to echo what you said and clarify, community health improvement plan is sort of this time where all agencies and all community members throw down, right, with trying to figure out how we're going to meet these prioritized goals. So it may take resources and efforts from many agencies to create that health improvement plan and implement. But the strategic plans, at least as it's written here, are really about, for us at health departments, are about the department's ability to meet goals that play into the improvement plan, although we need a community to do it. It's not going to be just on a health department to do it.
I'm going to stop there. I feel like I've been talking too long. Do people have reactions to this model? Is it understandable? Are there concerns? I see silence.
I think it looks fine. I
Looks
think
fine?
it does, I mean, I think it looks like a well planned out way to look at the community as a whole and take action. I think that's right.
People concur here? Okay. Given that, I got one piece of paper. We got all kinds of pieces of paper for you all here. I'm going to send another one around. This was our effort, based on this cycle and the role of this group, to write up a charge or a charter for this group. And I'm passing it around. I'm going to be quiet for 3 to 5 minutes so you don't have to hear my voice any longer. And let you read that document. It's intended to really zero in on this group, what it's trying to accomplish, and the pieces of the process that this group would take the lead on. Take a minute and give it a reading. I'll be quiet for 3 to 5 minutes here.
Just would like to say, at this time, you don't have anything to engage the public at this time. I mean, like, are you going to have surveys going out in the public at some point, or?
I think what the concept is at the moment is 2 avenues to reach people outside of this room. You all come from the community, and if there are publics, I'm going to use the term plurally, stakeholders or groups who aren't at this table, who have information that can be brought to bear, and you all know who they are, then I think you should feel licensed to bring that, to touch bases with those groups and bring them here. Now, the other piece, which I think Commissioner Porter, Chip, was commenting on earlier, is that the commissioners said to us very clearly last week that they would like to take these substantiated needs that are identified by this group and go out to the larger public and get their feedback on those needs. So there would be a prioritization piece of input outside of this group occurring at that point. Chip, am I capturing that
Yes.
concept?
But that will be after this committee has come up with the priority list.
Yeah, so that's that, Mr. Hickman, that's that little stretch of words that says community engagement right there is what we're talking about. another minute or two, I see one or two still left. This one-page document was our effort to bring together a description and narrative that is consistent with what we laid out in this flow chart. I want to just stop and see, is anybody, do people get through it? Do they feel it's understandable? Are there any comments or concerns about it? Chip, Jeff, how did we do? Did okay? This is built on discussions, but the honest truth is we hadn't shared it with them yet, so. I was waiting to be corrected somewhere on this one.
No, Karen actually commented to me too, who did this, because it was really good.
They've laid it out okay?
Yeah.
Okay, good, good.
So you guys hired outside help to do this?
Must have been, must have been.
It's got the academic ease to it.
Okay, any comments, questions on this? It's got draft on it. I would think we will take action at our next meeting to finalize it so people can take a look. But this is what we had conceived of as we thought through this process that this group would do. And our hope is that this isn't too far from what you might have guessed based on the letter that was sent out to you all. It's more detail, but in all honesty, we drafted the letter before we fleshed some of the detail out. So that was the intent behind it. I'm going to stop here. Any comments, questions? You're all so quiet and attentive. Oh, there we go. Okay, good.
What's your timeline on this, John?
That is where we're going next. Amy.
Oh, okay, good segue.
Thank you.
As planned, he paid me.
What I'd like to do, I'm going to, before we give you the timeline though, Amy, if you'll bear with us, we have an outline of the report, and then we're going to give you the timeline that we envision that occurring in, okay? Is that okay, Amy?
Absolutely.
Can we go in that sequence? Okay. We'll wait for those pieces of paper to get around. What you have in front of us, and here I'm going to turn to Heather, Dr. Barrett if I can, because she has been swimming around for the last, I'd say, month or so, or week, several weeks maybe, a couple of weeks, on the health needs assessments that are in place already, and is trying to help us bring together those documents in a way that is logical. And we worked with her and others to try to flesh out what this document would look like. I don't know, should I go through this, Heather, or do you want to? Okay. The purposes, as we see it, are very much like what we talked about a few moments ago in that charter. Create a shared understanding of the needs, understand how good our data is in relation to those needs, identify where new information may need to be collected over time. That's kind of all under this purpose of a shared understanding in the group. And then secondarily, and this deals more with the work of the health departments, creating a foundation for future health improvement efforts that they may be involved with. But I think that is true across every stakeholder in this room as well. This outline is rather traditional, and unfortunately you probably had too many academics in the room at one time when we put this together, but it's kind of a standard, background and purposes, methods, and findings framework. The background section is divided into two pieces. There would be a look at the health needs and an overview of the existing needs assessments that have been done, the three that I just summarized a few moments ago. There would be a discussion of understanding differences in the way those assessments set priorities, and a brief presentation of the needs that were identified through those assessments. In addition, through the Robert Wood Johnson Foundation work group process, Nishikant Campbell had compiled a number of lists, if you will, of people who provide or institutions that provide health-related services in Portage County. In addition, another one of the Robert Wood Johnson Foundation work groups put together its own list of organizations that are involved. And Nishikant is now in the process of merging those two lists. And the numbers are now, what, 100, 120? Is that the right neighborhood? They've identified somewhere between 100 and 120 organizations of different kinds that do health-related work or health-related assets, if you will. Now, this is a broadly construed list. You know, the school nurses would fall into this, for example, and so you got all the schools in Portage County. So before you think we got 120 health departments or something, or 120 community health clinics, this is a broader conception than that. And so there'd be an overview of those community assets. There'd be a set of methods that are used to set criteria for evaluating existing data. Dr. Baird is beginning to think through how we might attack that. I think that's a work in progress. We also envision, and this would start next meeting as we're thinking about it, you all, as people who are knowledgeable about this community, bringing to bear your perceptions on the needs that relate to health in this community. And it's our intent to ask you to do that before you see these three reports, so that we can benefit collectively from the fact that you work in this area and know something about it. There's many reasons to believe that the data we've got doesn't meet every need that's out there. And we don't really want people's thinking about this process to be limited by the data sets that we have available. That's one of the pieces of thought there. So there'd be a methodology piece. And then there'd be some findings. Description of the population in Portage County. And Dr. Baird is now working with a graduate student on our staff to get that put together. Some substantiated health needs, this list that we talked about. An identification of those assets as we boil them down. And then some future information on information on future data collection needs. So this is the outline that we envision the report coming in. We envision you all contributing directly as perceivers of the needs. We also envision you all contributing in guiding the process of assessing the data that we've got and coming to some judgments on what's a substantiated health need, and then aiding us in conceptualizing the next steps to this process moving forward. But this is kind of this is our evolving Bible, if you will. Is that the right concept? And I'll just lay that in front of you and see, are there things that are missing here, and what do we need to do? Any questions?
John, I just wanted to add that we're doing a community health assessment and a community health improvement plan, but we hope, Jeff and I hope, that the end product will have a community plan, but we'll also be able to separate Kent's needs out also, so that we'll have a health improvement plan for Kent too. So this process is not just, well, it's for the county, the whole site, but we're also taking Kent's needs into consideration also. And I think we feel that we can separate that and give Jeff a product that is specific to Kent, because we know that the needs of Kent are going to be somewhat different than the needs of the entire county. So.
You know, I think in general, if you look at Portage County from north to south and east to west, we cover a very communities. And to
whatever degree the data can be narrowed to offer useful insight at each of those community levels, you know, from Wyndham to Suffield, and from Deerfield to Aurora, we're going to have different kinds of implications. To the degree that we can work on pulling those out, I think that's going to be really important. And I hope that we can, I know the data is not necessarily, especially the data that we have, isn't necessarily finely cut to allow us to do that. It wasn't collected for that purpose, and it's not necessarily reducible in that way. But we need to find ways that we can take the information that we do gather. And that also has something to do then with community engagement, where we need to get input from all of those areas so that we can adjust what, you know, we have a high level, this is what the county needs. You know, it should reflect what Kent's specific needs are, and we have better data to be able to do that. We don't have that kind of data for all of us in the county. We have some from Ravenna. We have some from other areas. But to the degree that we can, the word isn't quite personalized, but we can localize that, the findings and the recommendations, I think that will be very helpful.
I think that's why that Wyndham and Atwater are here too, to serve those areas that we don't have a lot of good data for. And so, please help us. And I have to say, for Dan Dareberry here, you know, I'm going to, you know, soapbox a little bit, but we couldn't pass a levy, and I'm sure that's, you guys probably didn't know that, for 55 years. And, you know, I always said that once we got the trustees in, Dan was at one point the Township Trustee Association president, and we were looking for a crack, and Dan was that crack. And we got into the association to the point where we have a relationship now with the trustees, and have, and I think that's a good reason why we passed our levy, and also the fact that 12 people came out to vote that day, and it was the right